welcome to Psychogenix. Dr. Lyons here, and I am about to explain to you how we do TMS, transmagnetic stimulation, at our clinic that I think works differently and more efficiently and is better suited for most patients. And there's many clinics out there providing TMS services, which are very valuable for treating a multitude of different conditions. For example, with depression, it has a success efficacy rate of about 80% in terms of relieving some symptoms, and about 50% of the time, a person's depression will go into complete remission by virtue of just receiving the TMS. One of the drawbacks and confounding variables that makes it difficult for patients to participate in TMS is the frequency of visits that's required. Most TMS centers require you to be on site for minimum 5 preferred sessions per week over a 2-month time period. For a lot of patients in today's busy economy and gas prices, that's rather difficult to do. So what we are doing here at Psychogenix is providing TMS, and we believe that we can achieve same type of results with a patient just coming twice a week. Well, how do we do that? Well, in prior videos, I explained how our TMS is guided by the brain scan findings from the electroencephalograph, the EEG, but more importantly, we also provide 2 additional services in addition to the TMS therapy. And let me explain what they are. The first, and I'm going to walk over to our infrared laser. We use, it's a company out of Colorado called Aspen Laser. And it's an infrared laser. What happens, and we just provide this service to a patient for about 10 minutes. This light begins to heat up and the patient begins to process this light all over the skull, the frontal lobes, etc. And what the laser is doing is activating a person's mitochondria, which are the little energy factories inside each cell, each neuron. So this is laser treatment, which is done for about 10 minutes, is akin to a pre-workout. We're getting the brain primed to receive the TMS therapy. We then have the patient sit in the Apollo TMS chair. And treatment for that is roughly 20 to 25 minutes. And in that time period, the patient can fall asleep. It's a very relaxing type of experience. And you'll see me receiving a TMS session in the next video. After the TMS therapy, that's the main treatment, we then have a post-treatment session. And that is sitting in our pulse electromagnetic frequency chair. And the patient simply sits down in the chair, like so. We turn it on, and then for 10 minutes, the patient is receiving pulse magnetic field energy through the chair and through these pads, and the body is getting charged up. So just like we did the TMS on the brain, we're doing the pulse magnetic field energy on the body. But while you're sitting here, we actually encourage you to go into a meditative state and reflect on your brain, see your brain according to the EEG that we give you, so you have a visual, and we get you to imagine that your brain is firing on all cylinders, both in the frontal lobes, the temporal, the parietal, and the occipital. So it's an active approach in which we encourage mindful meditation, active imagination, and it's for 10 minutes because we don't want the TMS to be simply a passive type experience where you lay there and do nothing. While you're getting the TMS, obviously you're in a passive state, but afterwards we want you to bring it all together using the active power of your mind and your imagination so that your brain begins to function the way it's supposed to be and according to the directives of your own mind. So our TMS approach involves a lot more coaching. It's an active approach. So each session when you come to the clinic, between the pre-treatment with the laser, the TMS, and then the post-treatment with the PMF machine, you're here roughly for 1 hour. So in the course of 2 sessions a week, you're getting a great deal of treatment, but it doesn't involve multiple trips to our clinic. I hope that explains everything. Be happy to provide additional information upon request, and I thank you for your time and attention.